I'd like to introduce pharmacist Larry Frieders from the United States. Welcome, Larry.
Hello, how are you?
Fine, thank you. Could you tell me your experience of LDN?
Yes, I could. I've been a pharmacist for, 4 decades. And a little over 10 years ago, Dr. Bernard Bahari called me and told me about how he was using low dose naltrexone, and he was looking for another pharmacist to help make some particularly in the middle part of the United States. He had a couple pharmacists working with him on the East Coast, but there was interest in my area around the city of Chicago. And after we talked a while, I figured, well, what harm would it do to at least give this a try? I mean, the standard dose for naltrexone is 300 or so milligrams per day, and here was this doctor talking about a 3 milligram dose, and I figured at 1% of the recommended dose, the chances of side effects are practically zero, and if this guy says it works with all of his experience and background, who was I to argue with him? So he gave me an order for a couple people in the Chicago area. I filled it, and son of a gun, they wanted refills, and that's where this whole thing started. I saw it happening. Dr. Bahari mentioned to me that he was using it for AIDS patients and cancer patients, but he was just beginning to see the effect with some of the immune-type diseases such as MS. And the first two patients we dealt with were multiple sclerosis patients, and they had it refilled regularly because it was helping them feel better.
How many patients would you say you've got now on LDN?
We don't keep a record because around the United States we have these HIPAA laws which kind of protect the individuals, and so I don't want to get myself in a position where I'm gathering data. But I would say right now we're somewhere in the neighborhood of 500 to 1,000 people currently using it in the Midwest Chicago area. Over the past 10 to 15 years, we've probably had many thousands of people who would start, and many of them moved away, and of course some of them are deceased. So it's been a large crew of people, and the number of conditions that people are using it for seems to be expanding almost every year. I just talked to a doctor yesterday who was very excited about using it for rheumatoid arthritis. And we've also had people with irritable bowel disease and other types of immune disorders who were successful with it. So the number of people, the number of potential people keeps expanding.
What questions do your patients ask you?
I think that most of the time they're worried about side effects and how quickly it will start working. The side effect profiles that are listed in the variety of the online or the website places, well, there were the questions would arise about fillers or how the compound was put together, and we wrote about these things. Dr. Skip and I did a couple articles early on when this was first catching on in the United States, and we found that maybe calcium was not the best filler to use because there was some binding going on, and definitely we didn't want people using slow release, so we were recommending just a regular prompt release type filler. And I've always not liked lactose as a filler because there's a great number of people who have a sensitivity to lactose, and even though there's a small amount in there, it just wasn't worth it in my mind to use lactose. So we've been using a cellulose filler for many, many years, and for people who don't like that idea, we also use rice powder, just plain old white rice powder. But in any event, that seems to be the number one question. I think it's generated by the information on the internet. The number two question is, what can I expect for side effects? And from my perspective, very few people experience any difficulty. On the other hand, they will tend to experience the things they read about if they're so inclined to react that way. So if they read that they're going to have vivid dreams and they're concerned about vivid dreams, then that seems to be what happens. But they do go away very quickly. And earlier on, back 10, 12 years ago, there was a concern about morning stiffness. So a number of people had morning stiffness. That hasn't been discussed much recently, so we don't hear about that. The only real side effect that I think is worthwhile keeping in mind is that the drug should not be used if you're also using an opioid or a narcotic pain reliever of any kind. I would originally think that a small 3 or 4.5 milligram dose would be insignificant, but we've actually, one of our oncology doctors here in the area actually had two patients who reacted pretty violently with some kind of withdrawal type symptoms when they had been on pain relievers. So we've got a hard rule: don't use naltrexone if you're also using pain relievers that have narcotics in them. And that's about it. Even some of the pain relievers that are not considered flat out narcotics, like tramadol, we suspect that there may also be a problem using tramadol with naltrexone. But if you're not using narcotics, the stuff has no side effects that we've been able to determine that were bad enough to cause people to stop.
Well, the LDN Research Trust, we did a survey about 4 years ago, and I think there were about 400 people that took part, and we found that only 5% of people experienced any side effects at all.
That's consistent with what I've come across. 5% would be a nice area to say that somebody has mentioned it, but again, like I mentioned, I haven't run across people who have had such side effect problems that they would just not use the drug at all. Opposed to the use of drugs, especially too many of them on a chronic basis. This is one of the exceptions. I think that people in severe pain ought to be given as much pain reliever as they can tolerate to keep them comfortable, and I'm very much in favor of this low doses of naltrexone, even though it seems contrary to my basic position on drugs and medications. This is something that we're not quite sure how it works, and it seems to have a persistent action. It goes on and on. I think it's related to the fact that it's eliminated so quickly from the body that it comes in, it does whatever it does, and then it's eliminated either through the urine or whatever, and the person is ready the next day for the next dose. So it's not like it's accumulating or you're developing sensitivities to it. It's like every day is a new day for this approach. That's relatively unique, I think, in the world of drugs and medicines.
I've interviewed now 137 people for this DVD, and some of the people were experiencing very bad pain and were on morphine patches, and they'd got to such a point where the morphine patches didn't really seem to have any benefits anymore. You know, they were still in chronic pain, and with the help of their doctors, they weaned themselves off these opiate painkillers and indeed started LDN. And they now tell me that miraculously, you know, people with arthritis and such conditions where they were in terrible pain, that because of taking the LDN, on a good day they feel no pain whatsoever, and on a bad day they have pain, but which is bearable.
Correct. I've experienced the same type of thing with some of our clients over here. If they can get off of the pain. Now, that's a good way to approach it, is to get off of the narcotics, but some people have tumors and they're dying and they're very ill, and in those situations I'm strongly in favor of giving them more morphine instead of saying that's as much as I can give you. Yes. I have a pretty strong history of doing pain management on people, and we were much supportive of using more and more morphine whenever possible. And all the myths about breathing difficulties and psychic disorders and mental problems, those are all mythical if you do this properly. So if a person really needs morphine to relieve the pain and they've reached a place where their dose isn't working, I say give them more. And we've seen doses as high as 2,400 milligrams a day on a lady who weighed about 100 pounds. And when her doctor decided to take her off because her tumor had shrunk, it took a total of 7 days to bring her down to zero. So she didn't experience those side effects of breathing problems and that whatever. So there's a lot of myths that control how health is provided in the world.
But it's amazing that LDN in such a small dose can actually help pain in such a big way. I find that really hard to understand.
Well, the thing that we got to keep in mind is that one of the ways that Dr. Bahari told me that he discovered this, one of the approaches was his clientele consisted of people with cancer and AIDS, etc., and some of the people he had on naltrexone doses at regular strength, because they were addicts and were in that situation, they were also having a difficult time paying for the medication. And at that time, he'd say, well, let's try a lower dose, and then a lower dose, and then another lower dose. He kept finding the same benefits as he cut the doses back. And so it indicates to me that he was finding something kind of in a serendipitous way that the research companies and the drug companies hadn't even thought of as, let's look at this in a smaller dose. I don't know how they pick their doses, but in the case of handling inflammation or pain from an immune disease, clearly less is better than more. That's far more affordable, too.
Yes.
I've got pretty good experience when doctors call me, when their patients come to them and say, I want to try this, and they don't know what's going on. I ask people to tell their doctors, just call Larry. And I will talk to them, and I'll guarantee to them that it won't do any harm. And I will tell them our experience with it. And that seems to help get them over that last hump. The one thing that seems that they're afraid of frequently is they go to their desk reference or whatever references they use, and there's nothing officially published on this. And then they're told, well, go to the internet. Well, you know how many things on the internet are questionable. Mm-hmm. And so what I say to people is just have them call me. I'll talk to them. I'll explain my experience with it. I'll tell them how safe that I find it to be. And I think they're open to talking to another health professional who's in their 60s, somebody who's lived through 30, 40 years of health care and medicines. I mean, frequently I refer to myself as the undruggist. In fact, I actually wrote a book of that title called The Undruggist. I came to the conclusion or the realization that too many of us take too many drugs. And when I was in school, people took, if they took 3 drugs, we had a statistical table that showed that their risk of serious side effects was about 80% higher than if they weren't taking any. And if they increased the drugs to 5 different drugs, their risk of serious side effect went up to close to 100%. In the United States today, and probably in most of the Western-type societies, people are taking 10, 15, 20 drugs per day on a simultaneous basis. I just did a consultation last week for a 75-year-old man who had been an alcoholic, who had kidney failure and liver problems, and he was on 13 or 16 different medications, most of which were making him sicker. Mm-hmm. So this is where I came to this. I wrote this little book thing about the undruggist. So I'm not a strong proponent of excess drug use. In fact, in my pharmacy, we don't sell commercial drugs. We only do the compounded versions. What? And LDN seems to be like the only real chemical drug that we have available on a regular basis. Mm-hmm. But it's a different perspective, and I can come at this from the position of a pharmacist. I've also got a business degree, and I've also completed a master's degree in philosophy, and I specialized in medical ethics. So when I talk to people, I can come with education, background, and experience and say, this stuff is safe. So I think that if you have pharmacists who are willing to take that role, so that when the doctor has that question, well, I don't want to trust just the internet. Is there somebody I can talk to? The pharmacist should step forward and say, look, I've got hundreds of people using this stuff, and there are no problems or complaints. Mm-hmm. And the doctors will say, okay, I'll buy into that idea. Let's give it a try for a month or two. And sure enough, within a few days, the patient is feeling better. They report back that they're feeling better. And the doctor then says, well, maybe somebody else could benefit from this. And that's how I think is a good way to grow the whole thing.
If anybody listening is in the Chicago area and would like to try LDN but haven't got the name of a doctor who could prescribe it for them, would you be able to help them?
I could help direct them. I think it's best if they would stay with their own doctors. It does not have to be a neurologist. When you've developed a relationship with a doctor, it's good to maintain the relationship and not step outside of that just to get a special drug. So I would encourage them to have their doctors call me, and I will talk to them. Mm-hmm. And I'm fairly good at being persuasive. I can I've got a very high success rate. I've had one doctor call me a witch doctor, which I think was a compliment in a way. For the most part, they're very receptive of my input. And like I said, I think it's best for people to stay with their doctor, not add another doctor just to get a new drug. That can be harmful, you know. If Dr. A doesn't know what Dr. B is doing or disagrees, and the only person who's going to suffer is the patient. And as I've written in one of my books, nobody can care about your health the way you do. Even though you'd like your doctor to care, they can't. They got too many other things to be concerned about. So although they're careful to do things correctly and they do the best they can, when it comes to my health, I'm in charge. When it comes to your health, you're in charge. But I think adding additional doctors into the mix can make things pretty dangerous. Well, the dosing question comes up occasionally. People say, well, I don't want to start at this dose, or what's the best dose? In the beginning, Dr. Bahari used 3 milligrams. And then a few years after that got going, everybody seemed to want to have 4.5 milligrams. And then it all switched back to the 3 and 4.5, and there's pretty much a 50-50 mixture. Some people who are concerned about, they'll make the observation that they're very sensitive to drugs. They will want to start lower to see what this is going to work. And so we frequently get prescriptions for a 1.5 milligram dose. And the patients, when the doctor will tell them to take 1 a day at bedtime, and then after a week or so, go to 2 a day, see if it's any better or any worse. And if after a couple of weeks, go up to 3 a day, which is 4.5 milligrams. And generally they end up at 3. We make any strength because we're a compounding pharmacy, but the person, I think it generally focuses around the 3s. And I don't think it's really a dose-related response. Whatever's going on is being triggered by the naltrexone, but it's not necessarily the naltrexone that's doing the job. It's somehow getting in there with the endorphins and the immune system and the inflammation and all those things working together. And I kind of always mention the fact that I think that the naltrexone triggers that response in the body, and then the person's own body takes over and helps relieve the symptoms that they're experiencing. Arthritis, irritable bowel disease, even things like psoriasis, I think would be a wonderful approach. I've had people use it, and they were very pleased. The redness in the scales went away. So if you can identify your condition as possibly an immune-type condition, naltrexone might be the thing to give a try to. We even had somebody with dermatomyositis, which is a very strange immune disease. But they took it, and some of their lesions got smaller. So I think it's all tied together with the immune system, but none of us quite know exactly why. But it reminds me of when people talk about their automobiles. I don't know how it works. I just turn the key and it starts. Well, I think that applies to most of us, and if we're to be honest, we really don't know how naltrexone works. We just put it in our mouth, and the next day we feel better.
Well, thank you very much for sharing your story with us, Larry. I really do appreciate it.
You're quite welcome. I really enjoyed talking to you. Thank you.